Welcome to today's PPS workshop. So today we're focusing on the clinical notes section as a whole in PPS. So that will include us going through the following topics. So first of all, we'll cover the security and access controls side of things. Then we'll explore the uses of the treatment episodes for clinical notes in PPS. We'll also explore the consultation screen as a whole. So we'll go through using custom forms, capturing client signatures, how to attach documents and send letters. And at the end, we'll also go through the exercise software integrations that we have within PPS. So as this is a workshop, obviously, any questions that you have, please feel free to send them through on the attendee chat, and we'll do our best to answer those as we go along or at the end of the session. You will also, at the end of today's session, get an email with a link to this, what we've gone through today. So it will be a pre-recorded session that you can watch again if necessary, following on from today. So the first thing that we're going to go through is the access controls within PPS. So this will only apply to the system administrator, or only the system administrator can add these access controls in, but it's useful for everyone to have an overall idea as to what they do within the system. So when you're adding your new users into PPS, you'll be able to set their access control levels here. So if we just move their login details. So within this section here in the settings screen, you'll see you've got every area of the system. And as we work our way down, you'll come to the clinical notes section, right at the very bottom here. So within the clinical notes, you'll see we've got the ability to prohibit their access, modify, add, delete, print, export, and own-only rights. So just a brief overall view of this. Really, really important if you've got reception users or admin users in PPS that you perhaps don't want to be able to access consultation notes, restrict their access level from the very beginning. They won't be able to go in and read any notes or make any changes. If you've got locum practitioners or people that just come and work for themselves in the system, then you might choose to use the Own Only tab. The Own Only tab will mean that they can only ever access their own clinical notes and their own patients in the system, so that they wouldn't be able to necessarily go and look at someone else's notes within the diary. You'll notice as well we've got all the different areas of the treatment episode. If you don't understand the treatment episode at the moment, don't worry, we'll go through that later on today. But here we're just going to, again, be able to restrict their access to each individual tab of that treatment episode. So if they are an administrator, you may still want them to be able to access the admin tab, but that's it. So they wouldn't be able to access at a clinical level. Similarly, just at the bottom of the settings panel, so in the access control, you've also got the option to prohibit access at location level or department level. So just really useful things to add in to your user base if you don't already have them applied, so that you can make sure that no one else is accessing notes unlegitimately with no reason to do so. So, going into our treatment episode within PPS, so the purpose of a treatment episode as a whole, it is acting as a case or a blanket over a number of sessions that a patient has with you. Primarily probably designed for insurance purposes at the time, but they extend out to all the different cases and reasons. So you could have, let's say, an elbow injury on the go at the same time as a knee injury or a podiatry related issue. You can have all three open at the same time, but they could all have different billing parties, different referrers, and different outcome or discharge reasons. So all we're going to do, first of all, is click onto the treatment episode on the left-hand side. And you'll see it's already selected my patient because PPS remembers the last patient you were dealing with. And it's now asking me to select a treatment episode for this client. So this is just as that example before, this patient has 3 different treatment episodes on the go at the same time. Now, in this instance, I'm going to create a brand new episode. So I'm just going to click on new at the bottom here. And this will then take me to my new treatment episode details screen. So the first thing is the top section, so we can pop in a start date, a name for the treatment episode. If you don't want to give it a name, it will just default to routine treatment 1, 2, 3, and 4, and so on. Really useful if you do know what the injury is. For example, you might want to pop it in under elbow injury, knee injury, and so on. Then we can select the practitioner that's responsible and locations and departments as necessary. If you don't use those, don't worry, they won't apply. Then we move into the different sections, so these different tabs that we were talking about earlier. And you've got the first 3 tabs, which are the main points here. So you've got your billing details, admin details, and clinical notes. So billing details, first of all, who is paying for this patient? So is it a client or is it a third party? Now, this is not obviously clinical notes related, but it's just useful, again, to see where the treatment episode starts from. So this can be created at the point of booking or the point of adding the appointment into the diary and setting up the patient. So this could potentially be something that an admin user might do or a reception user might do at their level. Most importantly, you've got the opportunity to pop in authorization codes, policy numbers, excess amounts, and so on. On the right-hand side, though, you'll see we've got the ability to set a session limit. So if we set that as 6, it's going to start counting down for me. So that's relying on consultation notes. So every time you pop in a clinical note or a consultation under this treatment episode, it will take 1 limit off that session limit. So it'll start counting down for you. So that's one to remember, especially if you're charging for DNAs. We always need to have a consultation note written up if you want it to be included on the DNA session. Next one along is just our admin details, so referral dates. So anyone that's been referred, we can pop in their referral sources, contacts, and so on. And you can also pop in things like referral letters and discharge letters. Up to you. Again, might be something, a job that you'll have your admin users do instead. Then right at the very bottom, you'll see we've got an estimated end date. Now this is really useful because if you've got patients that come in and they're expected to be finished by a certain date when you've got your referral come through, then you can pop that date in for the future. So if we say it's 28th of August, then that will mean when we come to do reporting, we can see breach dates, anyone that's going past that date, so that we can report on them and get them back on track immediately. So when we're happy with this treatment episode, all we're going to do is click save at the bottom here, and it will create the episode for me. And I can now go into my consultation on the left-hand side and select it from the list. So if I go for elbow injury and click select, it will open up for me to my new clinical notes screen. Now, don't worry about the treatment episode in terms of the clinical details. We'll go through that in a moment, so we've not just missed that at all. So clinical notes screen, if you're not used to this at all, first thing is this left-hand side where we're highlighting, and this is your past history. So everything that's happened previously with the patient will start to build up for you there. Now you'll see this is treatment episode led. So I've got my elbow injury at the very top. So I've got nothing underneath at the moment because it's a brand new injury. Now just above that treatment episode, can you see I've got 2 cases, so I can filter on between them two. The first will show me the history for this treatment episode only. The second will show me the history for the all treatment episodes. So going back to the scenario where I said this patient's got 3 treatment episodes on the go at the same time, you can see now while I've clicked that, it's opened up all my different treatment episodes and all their consultations categorized underneath each one. So here I'll just have the ability to catch up on previous notes, anything that might be remotely related, etc. Okay. Click back on the first tab, and that will take you back to the just the one single episode, so just viewing these case notes. Now, moving on to the right-hand side, this takes us to our free text screen. So this is just where we could say patient came in with pain in right elbow. Okay. Now, just going to the toolbar at the top of this screen, I can start with problem, examination, assessment, and so on. So you can see here, these are just subheadings, and you can change those subheadings if you want to something more relative to your practice or your discipline. So you might want to change that to SOAP notes, for example, in the physio discipline. Adjacent to those subheadings, you've got symbols and text entries. Now the symbols, we do have physio symbols within there. So if we hover over, it will just tell you the meanings of them. And it will just enter it into the consultation notes for you like so. Now the text entries are something that you could build your own examples of. So if we just choose the examples that we've got here, if we go for the objective MSK, choose the body area, and it was the right and it was the elbow. And you can see as I'm clicking through here, it's just taking me through to each different sub-menu and subtext within there. And it's just really useful if you're using your clinical notes on an iPad, for example, or a tablet device, rather than you having to type out each time you're manipulating each area, for example. You could just keep touching each button, just keep pressing the button to develop the next sub-menu. So really useful if you're working like a triage method, for example. As I say, the text sets, they're custom built, so you can put your own stamp in there. You don't have to just go with the standard ones that we have. And you can access those within the lookup table. So in the tools menu, you can get those set up and put your own ones in. Now, the last thing that you'll notice that we've introduced within our clinical notes is our spell check. So you've now got the ability within your clinical notes to have the standard spell check that we're all used to. Right click and it will take you to a list of abbreviations or options, or you can ignore and add to the dictionary. So that's there for you to use. If you don't have it enabled at the moment, again, back through the tools menu and the settings screen to enable it if you need to. Now, moving on to our forms. So just going to the top of my free text screen, you'll see I've got consultation notes or forms, and the forms are in a tabbed view. Now, the forms are, again, custom forms. So you can either go with the standard ones or the stock ones that we provide. You can manipulate those stock ones to your own standard, or you could create a brand new one. It's entirely up to you what you choose to use. So if we first of all just go for the general assessment form, this form here, it produces a body chart like so. So I can just annotate or draw on it, use my text marker to enter my text like so. Or I could use the webcam to take a picture. So if a patient's come in with poor posture or a fracture to the foot, we might want to take a picture of before and after. Working our way down the screen here, you'll see we've also got some free text options. So we've just got free text questions. We could also have tick boxes and drop-down menus and so on. So it's entirely up to you which kind of questions you want to ask. And certainly these aren't set in stone. So you can manipulate the forms and delete some of the questions that don't apply to you guys. Now, if we just move on to the diabetic foot assessment form in my podiatry section, you'll see the quality of data that we're collecting here is a lot easier. So we've got a lot more date values, tick boxes, drop-down menus, and so on. Now, the benefit of using the forms in this style is that we can then report on it. So at a later stage, we could see how many patients we've had through the doors that were smokers, how many type 1 diabetics we treated last month, and so on. So as I say, entirely up to you in terms of what you want to put in the forms and what questions, but they are really, really powerful when you come to doing reporting at a later stage. One of the other parts with the forms is the ability to capture a patient's signature. So if we just go to the client signature section here, now this form that I've developed here is just an example. So you can see I've just got basic text options at the top of my form, but that can be whatever you want. You can put your own questions in and you can put your own answers, answer styles in as well. So it could be radio buttons, it could be check boxes, drop down menus, whatever you need. And these are really useful for the patient signature, especially for things like consent forms. So if you want to build your own consent form in the system, you're more than welcome to do so. So right at the very bottom here in my client signature, if I just click on to capture the client signature, you can see all we're doing is just signing like so. Now, this could be by using a touchpad device. So it could be something like you're using PPS on a iPad or a tablet or a phone even, where the patient just touches the screen to sign. Or you could have a plug and play device like a plug and play signature pad, plug and play pen that you can use. PPS, the signature section will work universally with any of those devices. There are a couple that our support team have tested themselves, so they'd be happy to give you the brand names of those. But as I say, it works on pretty much any of those devices that you want to use. Now, once we've signed this form, what will happen is if I save the form, it will encrypt the signature. So it won't allow me to go back in and manipulate either that signature or what was contained in the form. So I can't go back in and change what was answered and what questions we consented to in the very beginning. And it's locked in this database indefinitely. So you'll never be able to go back in and make any changes to it or delete it without the system administrator's kind of agreement. So as I say, that works really well if you want to use it for your consent forms and so on. So moving on again, back to the top toolbar of our consultation notes. The third one along, which is our paperclip icon, this will take us to attach a document. So it's just giving us the ability to attach any scanned images, any letters and so on that the patient might have that might be relevant for us. So if I just went for a logo here, give it a heading, and then you've got two options. You can either use the scanner or we could use the three buttons to find it on our PC, or alternatively, obviously, you could use a camera or webcam. So if we just go for the three buttons, it will open up to our Finder screen. So it's just asking us to find the picture or the image on our PC. Double click the image and then it will just add it to our folder. So it will back it up within PPS. So you don't need to keep a local copy of that file as well. And you'll see everything's going into my history for me now. So I've got a previous history of everything there and it will save it for me, as I say. So it will back it all up within the clinical notes screen rather than me having to have anything saved outside of PPS. Going back to the top screen again, fourth icon along, so just adjacent to attaching a document, we've got send a letter. And this will allow us to choose from a list of preset templates. So this is all through the activities section in PPS. You'll be able to build your own templates and use merge fields. And we can just pull information out about the patient. So it just saves us from having to type information out again. Or duplicate any information. We'll just be able to pull all the stuff out that we need. So if I just went for the GP discharge letter and open that up, you'll see it opens up in a Word document for me, like so, and it auto-fills my patient's doctor details, my patient's details and their demographic information. And where we've got here, just where we're highlighting, this could also be information that we've put in on a specific custom form. So there could be questions that we've answered in those forms, like the diabetic foot assessment form as an example, that we might want to pull information back out from. So again, it just saves you the duplication, so saves you from having to type it out or copy and paste it back in. When you're happy with your letter, you can just say it's completed. And again, it will save it in the history for me. So I'll have a preview of that letter being sent. Just one thing of note with the letters, just where we're hovering here, we've got in the bottom left-hand corner, the ability to either print it off or email it. So if you print it off, it will just go straight to direct to your printer. Emailing it will attach it as a PDF to the email for you that you can again then send through PPS. So you'll have a record of that being sent with a specific date and time as well. Okay. Now moving back to the top taskbar at the top, the final three options are my exercise integrations. So currently we integrate with PhysioTools, Physiotech and Rehab My Patient, and all three will open up within PPS. So they will allow you to register your patient direct through PPS so that you won't have to pop in things like their first name, surname, date of birth and so on again. It will just automatically integrate for you. Now, these are all available to add in using the settings screen in PPS, so going back to the tools menu, or alternatively, there's a quick link to your consultation screen. So use this little settings cog at the top here, and that will take you to the general settings for consultation notes. So here you'll be able to change those buttons and change your add-ins and so on. So going back to the top here, if we choose Rehab My Patient as an example, but as I say, you can use any of these options, it will load within a tab here for you. So can you see where we've got our other tabs open? You'll just have the Rehab My Patient tab or the Physio Tools or Physiotech tab open, and it will pre-register your patient for you. So we've got George Baker already there. And you'll just then have the option, as usual, within any of your exercise softwares to create new exercise plans, see the previous available to you. So entirely up to you which one you choose to use. All of them integrate direct with the PPS system and will do the same or a similar thing. So last thing to mention within today's session is the updating of the treatment episode. So when you're happy with your consultation notes, you'll have the ability to save them and complete, and it will save them in the ether for you. So they'll always be set there for you. The treatment episode itself, we're just going to adapt those clinical notes section, that clinical notes tab section that we were in before. So going back to my history on the left-hand side, where I'm highlighting, where we've got the red treatment episode, if we just click on that, it will open up to our treatment episode details screen that we were in before. So we're moving on to the clinical details tab third one along. And this just takes me to my general overview section. So here we've got the ability to pop in things like a diagnosis, whether it was the first episode or recurrent, treatment categories, and so on. So you can see here we've just got the ability to add to from these tables. Now remember, any of these tables that we've got here that I'm clicking on, you can pre-fill, you can pre-populate. So you don't have to go with the standard ones that we offer in these drop-down menus. You can put your own, for example, diagnosis codes in, your own outcome and discharge codes. And again, all available through the tools menu. You'll just be able to make those changes to all the lookup tables that we offer. So when you're happy with your treatment episodes, your treatment episode that we've set up here, all we're going to do is click save, and it will save it within that history for me. So the next time I go in, this section here will be pre-populated with what we've entered. Now that's not to say you can't go back in and make changes at a later stage. So if you want to go back in when you're in the third consultation to add in the outcome with the discharge status and so on, you can do so. So you can keep updating this as you go along to treat this patient. And then once you're happy with the discharge and once the patient's been completed, you'll be able to pop in a treatment end date. And that will just mean that you can never go back in and add further consultations to this treatment episode. So it will effectively be a closed case. Again, obviously, you do have the option to reopen it if you need to. So you could just go back in and change this end date if you wanted to add further consultation notes to it. So as I say, when you're happy with your consultation notes, all we need to do is just close, and it will ask us if we want to save everything. We'll say yes, and it will save them in the history for me. Now, one final thing that we haven't mentioned yet is the ability to sign off the notes. Now, there are two options within PPS. So you can sign your notes off by using this where we're hovering here, this button here, and that means that you'll pop in your password and they'll be signed off indefinitely. So you'll never be able to go back in again and modify those or manipulate those notes. And if you wanted to make adjustments to them, you'd have to create a second consultation and just pick up where you left off effectively. Some people prefer that. That's absolutely fine. The other option is obviously just to save your notes and not sign off. Now, that does mean that you could go back into the consultation screen and edit them at any point. However, bear in mind there is an audit in the background, and the audit is always keeping a log of what happened on what date and what time. So you'll always be able to see if someone did go back in and edit the notes a week later. and put anything else in. But it does just mean that you've got the opportunity, especially if you're brand new to clinical notes or electronic notes as a whole, you've got that opportunity to just go in if you've forgotten to attach a document or so on, just to pop them back into the system. So, entirely up to you if you want to either sign off your notes or use the audit just for the protection. Both of those are completely valid within PPS itself. So, as I say, that will pretty much go through that's us going through the consultation notes. So, if there's anything else, any other questions that you have, please feel free to send them through on the attendee chat, and we'll do our best to answer those. If there's anything we can't answer today for you, then we will send you an email outside of this workshop and go through them outside of the workshop itself. As I say, at the end of today, you will get an email with your recording so that you can come back and watch this if there's any parts that you've missed or if you tuned in a bit late. And you'll also get some course notes to go alongside it. If you do have any further questions after today, feel free to send them through to our support team who will be happy to answer those. So thank you for attending today. Hopefully that's been of use for you. Any other questions, as I say, please feel free to send them through. Thank you. Goodbye.